Hi everybody, welcome to Healthline. I am Gregory Zarin and I hope you had an amazing Christmas. Did you get some great gifts? Did you spend time with your family and friends? Were you healthy? Did you overindulge? Did you underindulge? Did you already plan out your New Year's resolutions, as we say here at your New Year's intentions? And for all of you that celebrate Christmas on January 6th, Schnorra vor Zurbsund, Jev Nordari, that is for you, Auntie Rima. Okay, so 2015 is coming to a fast end. Did you accomplish everything you wanted to? Did you check off those goals? Were there things you kind of missed, things that you wanted to do? Here's the great news. The New Year's is right upon us. But as we say goodbye to this one year, we need to celebrate the great victories we've had. And here at Glendale Adventist Medical Center, who sponsors this show that we bring to you with the intention to bring whole person care, God's love, and health on every level, Glendale Adventist Medical Center was recently honored with 3 Women's Choice Awards for patient safety, heart care, and orthopedics. They are one of 310 hospitals in this country. So the great news is that when you walk into the doors of Glendale Adventist Medical Center, you know that you are covered on all parts. Stay with us. Take a deep breath in. Deep breath out, get a glass of water, because joining us throughout the show will be specialists in each of these fields. More when we return. Do not go away. Welcome back to Healthline. I am Gregory Zarin. Did you take a deep breath in? Deep breath out, and did you get your glass of water? So it's a victory here at Healthline. Glendale Adventist Medical Center has been recognized by Women's Choice Awards, heart care, orthopedic care, and patient safety. First on the couch is Dr. Vahan Sepkinyan, board certified from Glendale Adventist Medical Center Orthopedics. Congratulations, doctor.
Well, I think the entire orthopedic department deserves that congratulations. Thank you.
How does it feel?
It feels great. It feels very proud to be on the medical staff at Glendale Adventist Hospital. The mission of Glendale Adventist Hospital, like you mentioned, is whole patient care, and our hospital has always had that foresight to provide that care by utilizing the best practices and always being on the forefront of staying on top of recent research, evidence-based care to provide the best care for their patients, and in partnering up with their medical staff, they've been very welcoming to provide that care for their patients.
Thank you, doctor. The award was National Blue Distinction Center for Knee and Hip Replacement by Blue Shield and Blue Cross, Joint Commission Certificate in Joint Replacement. What did the orthopedic division have to do to win this award?
Well, like I mentioned, Glendale Adventist has worked with our orthopedic department closely in order to provide the venue and all the services available to provide this great orthopedic care. Now, as recent as the past decade to past 15 years, hip and knee replacements have been sort of a daunting procedure for patients to undergo. If you think about it, we're basically taking out what you were born with and putting in metal and plastic. Now that's a little tough for patients to wrap their heads around. And certainly it's not just the procedure itself, but it's also the postoperative course, which
because that's the tougher part, isn't it?
That is the tougher part.
The recovery part.
Exactly. And surgeons, orthopedic surgeons, it's very easy for us to look at the X-ray and say, hey, you need a knee replacement because that's all that we can do. When a patient hears that, it's certainly not something that they take in it easily as we say it. The postoperative course, it certainly can be uncomfortable. And many years ago, we were very reliant on intravenous pain medication, which would cause nausea, which would cause confusion. Just was not healthy for patients. It could also cause problems with patients' breathing. Nowadays, what we have is a multimodal pathway for pain control. We have our great anesthesiology department who can administer various blocks to control postoperative pain. We can mobilize our patients on the day of surgery, whereas in the past, they would have to wait about a day or so until they were feeling up to it. Okay.
And you also have patients that actually get up out of their bed the day of their surgery.
Correct, sir. Yes. All those are made possible by a concerted effort between anesthesiology, orthopedic surgery, nursing, physical therapy and occupational therapy. And our focus is the patient. And all that is made possible with our partnering with Glendale Adventist Medical Center.
So what's the one thing, I mean, you discussed why you have won this award. Personally, what do you feel is the reason, as an orthopedic team, made you win this award?
I feel that all the tools were made available
Love that.
for us. We bring the knowledge that we've accumulated over the years with our experience, with our maintenance of our education, by staying on top of recent developments in pain control, in surgical techniques, in different implants, newer implants that we use which last longer. And Glendale Adventist has always been welcoming of that type of information, and we're very fortunate that that they work with us, and they provide the venue, the manpower to allow us to provide those services for our patients. Because in the end, that's our goal, is to provide great care for our patients.
What are your final thoughts in regards to orthopedic health and our viewers?
Well, as orthopedic surgeons, we're usually at the end of the course of treatment for patients after they've undergone a series of conservative measures. But certainly, we always have to think about prevention. What I would like to say for our patients is to stay active. Maintaining healthy muscles, strong muscles, is what's going to protect our knees and hips and our backs. Maintaining a healthy weight is going to prevent the progression of knee arthritis. All those things, as long as you maintain an active lifestyle and a healthy lifestyle, you will avoid having to see someone like me.
Not that we don't want to see you. Thank you. I mean, I'm loving seeing you. Doctor, thank you so much for representing the amazing board. And again, congratulations to everyone at Glendale Adventist Orthopedic Center.
Thank you.
More when we come back. I think we're going to talk about affairs of the heart. Do not go away. Welcome back, and I promised you an affair of the heart. Joining us on Healthline is one of my favorite doctors, Dr. Harry Ballion. He is board certified and the director of the cath lab at Glendale Adventist Medical Center. How are you, doctor?
I'm doing great. How are you?
Love seeing you. You've dropped some weight.
Yes, thank you.
You got your heart health on.
That's right. I practice what I preach. So.
I love that you said that. Glendale Adventist Medical Center was recommended women's choice for heart care, and it provides quality care for cardiac patients and improved outcomes and lower rates of complication. What does that mean, doctor?
First and foremost, I'm proud to be staff at Glendale Adventist. We take pride in what we do. We take pride in our patient care. So we emphasize on practicing evidence-based medicine, and our final outcome is making sure our patients are well taken care of. As far as complication rates, that entails morbidity, mortality. As far as complications in the cath lab, for example, and afterwards. So first and foremost, as the director of the cath lab, we've actually made great progress over the last many years as far as having one of the top safety profiles as far as our patient peri-procedure outcomes. Secondly, our door-to-balloon time, which means from the time that the patient picks up the phone and as they're having their heart attack and they make that phone call to the time that the patient is actually in the emergency room and the cath lab and the artery that has been blocked causing the heart attack is open. We've had actually the second shortest time in the nation.
Which is?
23 minutes door-to-balloon time. So essentially, we have a well-oiled machine as far as taking care of our cath lab and our patient caretaking. But aside that, we've also emphasized on preventative medicine and cardiology in the sense that we preach and make sure our patients are doing the right thing so they don't end up in the cath lab. We've had
Doctor, for those people that don't know, what is a cath lab?
Cath lab is actually our designated rooms where we have a fluoroscopy machine where patients that come in with chest pain and they have either abnormal stress test or they're having an actual heart attack, we put in a catheter either through the groin or the radial artery in the hand, and under x-ray we're able to visualize. We advance the catheter to the arteries of the heart, inject dye, and then visualize if there are any blockages, and actually we can put a small wire in a balloon open up the blockage, and then put a stent. So,
When you said from call time to balloon time, and you said 23 minutes, what is, just so people know, what is an amount of time that is actually,
it should be
when I
within
say
60 minutes.
within 60 minutes?
right,
Okay, because with stroke, time loss is brain loss.
Absolutely.
Same,
And-
is
and
it the same
thing
thing with
the heart muscle.
Time loss is heart
Time
loss?
is muscle.
Time
so,
is muscle. Okay.
when somebody's having a heart attack, the longer you wait, the higher the chance of permanent damage to the heart muscle, and also the chance of death also increases. So within the first hour is the golden time where the artery should be opened, and
Okay.
after that, with up to 2 hours, you actually have irreversible heart muscle loss, and then you can become a cardiac cripple. So essentially, if you wait more than that hour, you can have irreversible heart muscle damage, dilated heart, enlarged heart, and then basically your heart function is compromised to the extent where you're in the hospital every couple of weeks with heart failure.
Doctor, signs and symptoms for heart attack for women.
Women have a lot of the atypical signs
Okay.
and symptoms of heart attack. They may not have the classic chest pain radiating to the jaw, radiating to the arm. They may feel fatigued. They may
Okay.
have heartburn, and they may have more of a epigastric discomfort. So we actually make a very concerted effort to educate our ER docs and also our staff that any kind of vague symptoms should be still taken very seriously. We don't want to miss a heart attack, and especially in women, we want to make sure that any kind of vague symptoms, we take that very, very seriously.
And the signs and symptoms for men are?
Well, the classic chest pain is, chest pain with exertion, chest pain that is not reproducible, that is not pleuritic, as in with
Okay.
deep breathing, and then it radiates to the jaw, radiates to the left arm. Those are the classic signs and symptoms of somebody having a heart attack.
And so that people don't have to end up suffering from a heart attack and have to deal with a cath lab and all that stuff, what is your recommendation for people to have strong heart health?
Well, your body is like a temple. Whatever you put in your body is how your arteries and health is going to be. And it's not what you eat today that's going to dictate what's going to happen to you tomorrow. It's a continuum. What we do today is going to be impacting our health in the next 5 to 10 years from now. So obviously, first and foremost, any modifiable risk factor such as smoking. It's a choice that we make, and I tell my patients that tobacco should be eliminated from their habits. And secondly, exercise. You have to exercise 4 to 5 times a week, and
Minimum 150 minutes.
Right, and personally, I exercise daily, 6 to 7 days a week, 1 to 2 hours. I mean, that might be a little bit extreme, but definitely 30 to 45 minutes of exercise up to 5 times a week. As far as our caloric intake and also fatty intake, you have to minimize polyunsaturated fats, the powdery white sugars, the carbohydrates, donuts, etc. All of those should be eliminated. So higher protein, obviously the good fats such as that we find in avocados and walnuts, almonds, those are all essential, and eliminating the fried foods from our diet. We have to also focus on our cholesterol levels, and we've had great challenges in maintaining low LDL, which is the bad cholesterol, and we have actually new medications now that have targeted for us to achieve very low LDL levels, which actually then help bring down the inflammatory process in our arteries. And that's actually, we as the cardiologists and at Glendale Adventist, we take great pride in making sure our patients have all these modifiable risk factors in check. So.
And each patient is an individual conversation.
Absolutely.
Doctor, on a personal level, why do you feel the hospital won this award?
That's a great question. The hospital has been very supportive to provide us with the utmost technology, and so we can provide our patients with the best care. And one of the prime examples is in our cath lab, for example, we've actually have 2 biplane labs. And biplane meaning we're able to acquire the best pictures and using minimal contrast so we don't hurt the patient's kidneys. That's just one example. Other ways, the hospital has been very much in support of, again, providing the physicians with the tools that we can in turn implement and have great safety records and have great outcomes for our patients.
What I love is that I also heard from Dr. Sipkinian, it's all about just the outcome, a positive outcome in patient care.
Absolutely, and that translates into patient satisfaction, and that's why our patients want to be at Glendale Adventist when they need their medical care.
Doctor, you look great, and I love that during the break we talked about both of us dropping some weight and getting our health on, and I love the most is that you said you walk the walk and talk the talk. Okay, one of my favorite affairs of the heart, Dr. Harry Ballion from Glendale Adventist Medical Center. So, one thing I do want to say though, as soon as you light that cigarette and put it in your mouth, strong choice is to not light the cigarette and not even have one. I quit after 20 years, 2 packs a day because I chose not to smoke more than I wanted to smoke. Same thing with diet and exercise. You just don't wake up and you don't happen to be obese and you don't happen to be unhealthy. They are choices that you made. Make healthy ones. Give yourselves baby steps to get your health on. When we come back, we're going to share with you why Glendale Adventist Medical Center is at the top of its game with patient safety. Do not go away. Oh, and get a carrot stick. Welcome back to Healthline. So we've talked about orthopedics, we've talked about affairs of the heart, and now we're talking about patient safety. You know, when you walk into a hospital, their mission is to keep the patient and the family members and everyone safe. And obviously Glendale Adventist Medical Center has done that because they won an award. In the spring of 2015, this year, Glendale Adventist Medical Center received a hospital safety score from patient safety organization, the Leapfrog Group. Joining us on the couch are Patient Safety Officer Michelle Tremblay and the Chief Honcho, Michelle Cosgrove, Chief of Staff. Ladies, thank you so much for joining me.
Thank you.
Patient safety. Michelle Cosgrove, why so important? Why the importance of excellence at Glendale Adventist for that?
So when you think about it, really what could be more important than patient safety?
Absolutely.
When people come into the hospital, they want to be taken excellent care of. We want to make sure that their outcome is good. We want to make sure that we leave them in better shape when they finish their hospital stay. So patient safety is extremely important in every area of the medical center.
Michelle?
What I would like to say is that I think the patients and the family members not only see what we're doing, but they feel it. They see us double checking their armbands before medications are administered. They see the signage on the wall to remind the patients to call so they don't fall, so we can assist them. And we have commitment at every level of the organization, to education, to training, and to preventing all forms of hospital-acquired conditions.
Why did you use the word feel?
Because,
I love that.
Thank you. Because we are a faith-based organization, and our mission is to provide whole person care, and the patients and family feel that when they're under our care.
Why is patient care, other than, as you said, whole person care and God's love and everything, why personally to both of you is that so important? Michelle?
Basically, everything that we do is focused on the patient and the patient's well-being and the patient's outcome. And in this era of healthcare, really, we can't focus too much on that.
Because the healthcare has changed a lot. And other hospitals, you know, maybe focus on over here and a little bit of over this and over there. Is the primary attention for Adventist patient safety?
Absolutely.
Yes.
Our number one driver is patient safety, from the medical staff to the nursing staff to housekeeping, physical therapists, pharmacists, and everyone in between.
So then tell me what patient safety is. Pretend I'm a 5-year-old and I have no idea what it is.
So patient safety is about taking care of everything that happens to the patient during every encounter in the hospital.
So you're talking from when somebody walks through those doors?
From when they walk through the doors with their family member or their friends, we want to know, what medications have you been taking at home? We want to know what conditions they have.
Well, I love that you say that, because a lot of people don't. You know, one thing that we talk about on Healthline, though, is that just say no matter, you need to have the list of medications in your wallet, in your purse, or somewhere close by. So in case something happens, you take it with you, because the last thing a doctor or anyone needs to do is do something that doesn't work with the medication that you're on. So I love that you guys immediately go there as well.
Absolutely. The medical staff leads out on medication reconciliation, but we also partner with our pharmacy colleagues and nursing to ensure that the right patient receives the right drug, the right dose at the right time, every single time. And we have barcoding technology to help us do that.
I cut you off earlier. Where were you going again with patient safety? And I'm sorry about that.
Well, basically, patient safety is a collaboration between the patient, their family, the healthcare providers, and everybody who works in the medical center. So when we talk about something like preventing healthcare-acquired infections, there are many different initiatives that are involved in achieving that goal. Some of the things that we do are really simple things, like making sure that we always wash our hands before we have any encounter with a patient. And that includes not only the healthcare providers, but also any guests or family members that might have contact with the patients. And some of the things are more technical things, like we check to see if somebody has a urinary catheter, do they really need to have that catheter? We want to make sure that we use it for the minimum amount of time possible, because we know the longer we leave it in, the more chance that patient might get an infection.
And one thing too I want to say that we've talked about on Healthline is that when you wash your hands, in your mind sing happy birthday.
That's right.
And do it with warm water and do it vigorously. I have nephews, and what's really fun too is to do it with your nephews or daughters is, sing happy birthday together. So they practice that good hygiene. One thing too that I want to say for patients is that if you are going to go see a family member or someone you love in the hospital, and you have for 1 second think you have a cold or maybe even their sinuses, don't go. Because a lot of people don't realize that if you come in with an infection, that can compromise their health.
Absolutely. Patients in the hospital are vulnerable, and they're more apt to pick up infections, and even individuals, if they aren't really sick in bed, if they're carrying or at the beginning of their illness, they can infect their loved ones. So we do ask them to stay home out of respect for their loved one's health.
Personally, why do you feel Adventist won this award?
I think that we won this award because we have a true dedication to keeping our patients safe, and that's directly related to our mission. And our hospital completely supports us in doing everything that we need to do on a daily basis to make sure that our patients are safe.
Michelle?
And I'll say we're a medical center with strong integrity, and that everyone is absolutely passionate and committed to keeping the patient safe while they're in our hands.
Final thoughts on patient safety. Michelle?
Patient safety is a collaborative effort between the physicians, the nurses, all of the associates in the medical center, and the patient. And we want to encourage anybody who has any concern about patient safety at any time to bring it up so that we can address it. We don't keep secrets. We're very transparent. We're never really satisfied until we have no patient harm ever in the medical center. And so we will keep working until our last breath to be sure that our patients are safe.
Michelle Cosgrove, Michelle Tremblay, thank you so much for
Thank you.
keeping us safe
Thanks
at
for having
Glendale
us.
Adventist Medical Center. And before we end this episode, I just want to share with you all the amazing awards and certificates. Comprehensive Stroke Center, Joint Commission Certification in Joint Replacement, STEMI Receiving Center, Chest Pain Center, High Performing Hospital by U.S. News and World Report, Blue Distinction Center for Spine Surgery, Blue Distinction Center for Knee and Hip Replacement, Community Hospital Comprehensive Cancer Center for the American College of Surgeons Commission, Pink Ribbon Facility by Hologic, Breast Imaging Center for Excellence by the American College of Radiology, Top Docs by Pasadena Magazine. So I leave it to you like this. When you walk in through the doors at Glendale Adventist Medical Center, you should have not one question other than feeling amazing when you walk out. If you or someone you love has any questions about you and your health, all you got to do is go to the website or call 818-409-8000. There is someone there 24/7 to help you get your health on. On behalf of everyone here at Healthline, especially myself, thank you for spending this year with me. Thank you for trusting me with you and your health and your wellness. I will see you next year with more exciting episodes. Remember, the most important conversation you are going to have is about you and your health, so have one right now. Take care. Happy New Year. We'll see you soon.